Welcome to Green Time. I'm host Don Fitz. This episode we're going to be talking about single payer state by state. And with me I have a nurse and a physician who have done a lot of work on this. I have Mimi Signor, a registered nurse who is president of Missourians for Single Payer. Thank you so much for joining us.
Thanks for asking.
And I have Dr. Pamella Gronemeyer, who is vice president of Missourians for Single Payer. And you also work with the Illinois group, don't you?
You're right, Illinois Physicians for a National Health Program. I'm the co-president.
Fantastic, and it's important to remember that there's a lot of physicians who are in favor of single payer.
Physicians for National Health Program has 20,000 members.
20,000. Now, Mimi, what is single? I mean, a lot of people are familiar with the term single payer, but it's like if you watch mainstream media, you get the impression that there's only two choices: Obamacare and Trump care. But there's another choice. What does single payer mean?
Well, single payer is just a way to finance health care. I like to tell people, if you think of the number one, it's very easy. It's an easy concept. So it means one program for everybody, one fund, which is taxpayer funding,
right,
and one risk pool, which means everybody is in and nobody is out. When you have a large risk pool...
So even if you have a pre-existing condition, or even if you have something really bad, like serious cancer, you would still be covered by single payer.
It's like Medicare. Medicare covers everybody.
It is for everyone, and it's just considered to be one very excellent program of good quality health care for everybody. So there's no discrimination as far as socioeconomics or race or any other criteria like that.
Okay, well, what's the difference between saying single payer system and Medicare for all system?
Well, in many people's minds, it's the same concept, because Medicare is a single payer program. It's just not universal.
Okay.
And so there are those who want to expand Medicare, which is taxpayer funded, to everybody. However, there are some people who hate Medicare because what has happened to Medicare is the privatization of some of it.
Oh, okay.
So Part C is privatized insurance.
Yes.
But it's paid for with Medicare dollars. And then Part D is a benefit for the pharmaceutical companies to control prescription drug insurance, and they get to write all the rules and regulations, and the government can't control the prices that they charge.
Well, with Medicare now, I mean, you basically have Medicare, which pays 80% of most charges from the government. So
Yes.
it's a single payer, but then in addition, you have to get other kinds of insurance from insurance companies for your, to get your, if you go with conventional Medicare, you get supplemental.
Yes,
Otherwise, if you don't go with Medicare, conventional Medicare, and you go into Medicare Advantage, which is basically managed care for Medicare, but basically it's sort of a scam, because the government is paying 11% more for people enrolled in Medicare Advantage, so that insurance companies have made a profit off of it, and they offer a lot of benefits, like you can go to the gym and you get perks, but they have narrow networks, so you're not allowed to go. You have to go through your primary to see your specialist. So, and also with the medical benefits for the medications, you have to get a separate insurance for your medicine, because otherwise you're paying high rates. So then you have to get like two kinds of primary insurance in addition to going into Medicare.
Well, and so Medicare is not as simple as just signing up for it when you turn 65, or if you.
It's a good program. I mean, and most people get better care when they're in Medicare than they did a lot of times from their private insurance.
I sure did.
But the thing is, it's just not. I mean, it only covers 80%, and so basically, what we're talking about with single payer is we're not talking about Medicare as it is today. We're talking about enhanced or improved Medicare for all.
Okay, so that's very good. And so we don't want to have to say the word enhanced Medicare for all, so we just say single payer.
Some people call it NEMA. A National Improved Medicare for All.
Oh, okay, very good. Okay, now we have been talking, we've been on the show before, the three of us, talking about Medicare, about single payer as a national system. Now people tend to be focusing on, or many people are focusing on Medicare state by state. What are the why the switch in 2017 to a lot of emphasis on Medicare single payer state by state?
Well, part of the reason is, there's a cynicism, of course, about money and government. The ACA, also known as Obamacare.
Affordable Care Act, right?
Right.
Correct.
Okay.
It was really constructed, written by, and blessed by the insurance lobbies. And when that bill was in hearings, no healthcare advocates were invited to testify at the hearings, and in fact, they were forbidden to come. And there were 2 protests at the time by doctors and nurses and other healthcare advocates, and they were all arrested. And
you mean not everybody was supposed to be there?
Well, we weren't. No, but we weren't. They weren't allowed to be at the table. And
Okay.
basically what President Obama did was, this plan was written by the Heritage Foundation, which is a right-wing think tank, which also was what Romney Care. Romney put this into Massachusetts. So President Obama took a plan that basically was written by a Republican think tank, thinking that by creating this ACA, the Republicans would vote for it. Obama, in 19, when he was a state senator, Obama, there's a YouTube recording that says he says, I'm a single payer advocate. And he wants single payer, but it's just, they don't think it's politically feasible because they don't think they'll get it through the Congress.
That is amazing. Nowadays, people tend not to remember that Obamacare was the same thing as Romney Care, very, very similar, and that it was written by the Republicans because it happened in Massachusetts. Okay, we're going to take a break, and we're going to see a clip from the movie, which is, tell me the name.
Now's the time.
Now is the time. Now is the time. Health care for everyone. We'll see a clip, and we'll be back in just a minute.
Jackie Wolf asked me about doing a study for Massachusetts. So I said, sure. So after Massachusetts, people in Maryland saw the study. I did one there. Then Pennsylvania and Colorado, where my study has contributed to a campaign that's going to referendum this year to establish a single-payer-like program in Colorado. After Colorado, I did a study for Rhode Island and Oregon, and then New York. I also did a national study for PNHP, Physicians National Health Plan, of a single-payer national plan, HR 676, a bill in the House of Representatives. The results are basically always more or less the same, that if you bring in a single-payer system, basically through reduced administrative waste in providers' offices, in the health insurance industry itself, and through lowering prices of prescription drugs, you save 20 to 25% of current spending. When you eliminate copays and deductibles, the underinsured go to the doctor, and that's going to cost money. You may have an increase in utilization for non-hospital, non-Medicaid services of 15%. That's a fairly large number. So when Forbes looks at this and says, oh, there'll be a big increase, well, yeah, they're right. I'm assuming a big increase, and that's factored in. In some ways, I don't like to count this as cost, because you talk about the cost there, but you should also talk about the benefit. People going to the doctor live longer. If there is that need that's not being met, don't we want to meet it?
Welcome back to Green Time. I'm host Don Fitz. We are talking about Medicare we're talking about single payer, state by state. And with me, I have a couple of people very knowledgeable of this. I have Dr. Pamella Gronemeyer, who is Vice President of Missourians for Single Payer, and I have Mimi Signor, a registered nurse, who is President of Missourians for Single Payer. Now, we've been talking about some of the general issues about Medicare and single payer. But there has been a movement towards trying to do that. It's actually possible for a state to have a single-payer system. Was that close to happening in Vermont, and what occurred in Vermont?
Well, many significant social movements started in the states.
Right.
And so we think that perhaps that's the way it's going to happen because, the Canadian Medicare program started in the provinces. So that's sort of what we are aiming at now. Our goal is a national health program, but we can do it a state at a time. Vermont was successful in many ways and then failed at the end. Do you want to explain?
Okay, well, no,
what year are we talking about in Vermont?
Oh, we're talking about 2011, and then it was, because it looked like after the ACA was flipped, but it couldn't really totally go to single payer because basically you needed to have a waiver from Congress, which in 2017 would have allowed the states to come up with a single payer with a plan as long as it did at least as well as the ACA. So it could not totally have become a single payer plan until it got the waiver and until it figured out a way to finance it. Because what has to happen for a state to become a single payer plan, it has to get the federal money from Medicaid and Medicare to use for the people who live in that state. Mm-hmm. And right now, your Medicare money comes to the people enrolled in Medicare. It doesn't come to the states to distribute. So there are some issues that had to be worked out. But I was going to go back to just the reason why we're going to state is because basically we're going to have a Congress that will vote for single payer. And if we look at the way the distribution of the Congress is now, we're more likely to get a state like California or states that have a more liberal or progressive state legislature to vote for it than we are to get through our Congress.
Okay, so in 2017 and 2018, that needs to be the focus, and maybe later we could go through Congress. Okay, so things were really stalled in Vermont. Did the governor of Vermont have something to do with that, or?
So Governor Shumlin was elected in, I think, 2011, and he ran on single payer, and he was elected for it. Single payer elects leaders, and it galvanizes the voters and excites the voters, and they were excited. So he was elected with sort of a promise that he was gonna have single payer in Vermont, and so the bills passed both houses, and it looked like a big success. He was reelected. He had a tough reelection, but he was reelected, and it looked like it was going to work. The ACA was written and left room that if the states wanted to enact a single-payer program, they could do so. But they weren't allowed to get the waivers until 2017. So the states, meanwhile, had to, do the ACA enrollments.
Right.
And so Vermont did that. And what happened was they hated they had so much trouble with the website. It didn't work.
I remember
it was
that
complicated.
The beginning of ACA.
In the states that actually did enroll. And so people started to say, oh, the government can't do anything right. Maybe we shouldn't let the government, control our health care because they screwed up so much so far. And then, in the meantime, we're waiting for the waivers. And There was also some political maneuverings, like many of the committees that were supposed to be working on the state single-payer program. Many of the leadership on those committees were not actually engaged in seeing it succeed. So there was a lot of politics.
So it didn't. Well, let's move to Colorado.
Oh, can I just say one? I'm sorry.
Okay.
Vermont was smart, though, because prior to doing the single-payer movement, the Vermont Workers Center did they did a whole thing throughout the state of Vermont to prove to people that health care is a human right. Because, basically, in order to buy into single payer, you have to want to care about the person who lives next door to you and the person who lives down the street, their health care. And Vermont, they had prepared the way. That's why it was the first state that looked like it would do, because they had a 2-year movement to make health care as a human right.
We just have a few minutes left, so let's spend about 1 minute on Colorado. What were the problems with getting single payer approved in Colorado?
Colorado was going to be a amendment on the ballot. It was called Amendment Number 69, and it was pretty exciting. But people didn't understand that the tax they would be paying would still be less than what they were already paying for health care, and that was apparently done badly. In order to convince people that they're saving money by spending money, you have to actually show them what they spend and what they would spend and see that it is far more.
So the ads to get people to vote for it just didn't do a good job of convincing people.
The other thing about Colorado, it wasn't going to be a total single-payer movement because it was going to leave Medicare intact and it was going to leave the VA intact because, see, they couldn't yet get a waiver until this year. So, there were some things that were not perfect about it. But also the thing, they'll tell you in Colorado, was that they shouldn't have probably taken it to the electorate as early as they did, because they did not have enough people supporting the idea of single payer before they put it on the ballot. So, and then there was a lot of Koch brothers money that was spent fighting the initiative also.
You have to be very honest about what it's going to cost, but also compared with what a person is going to save.
Okay.
It's the savings.
Okay. Now, what happened? We just have a couple of minutes for this part, but what happened in California? There was the 2007-217 issues in California?
Well, California's been working on single payer for many years. I think it was the 90s that they had the ballot initiative, and that did very well. But, the other side has so much money for television commercials, paid commercials.
Well, it passed, too, in California before twice, but Arnold Schwarzenegger was the governor and vetoed it twice. So, there were issues.
So it was close to passing, but had Schwarzenegger not been governor, it might have passed.
Right, but the problem in all of the bills really don't have a mechanism on how it's going to be paid for, because a lot of the bills need to be fleshed out.
Okay, let's take a break. We're going to take another look at Now is the Time, a different segment, and then we'll be back in just a couple of minutes.
Congress for the last few years has been non-functional on any level, so they're not really going to move ahead for the national program. Most of the advocates around the country now are pretty settled that we need to operate at the state level in this movement. It's really exciting at this moment in history how much progress is being made at the state levels. The movement to educate and advocate for a universal publicly funded healthcare system includes everything from tabling at farmers markets, to having house parties, to having film screenings, to having speakers. Some states that are able to are moving toward a ballot measure. Other states are moving legislatively. In California, several times, single-payer health care actually passed legislatively, and the governor vetoed it, of course.
I'm thrilled to announce to you today that we just found out last night that our bill, House Bill 2828, will have a hearing next week. So while you're here, what you are doing today is getting involved and making a difference by coming down, demonstrating your numbers, and then going in that building and talking to every single legislator about this issue.
That's really what it's like, because you do not know. And nobody can tell you, well, how much does the CAT scan cost?
What's the current membership, the total number of members?
It's an advocacy group. We do have a Facebook group right now. It's about 50 people. I don't ever want to have to open my own clinic because of the fact that unless something changes, I have to deal with insurance companies, and that's just not what I'm in it for.
In Colorado, we have a ballot measure on the 2016 ballot.
We in New York, a year ago, passed the New York Health Act, which would set up a single-payer system here in New York. We're going to do it again this spring.
And now that it passed the Assembly, I think they clearly know about it, because it did go to a vote in the Senate. It didn't pass. We expected that because we didn't build that movement yet in the Senate, and that's how things obviously move along. Assembly, Senate, and then the governor has to sign off on it. The independent economic study by Dr. Friedman, UMass Amherst, showed that 98% of all New Yorkers will pay the same or less for health care.
98%.
98%.
I believe increasingly New Yorkers are going to say, yes, this is something that we can do. And the more of them that say that, soon they're going to start saying, why hasn't my candidate for the state senate signed on for single payer in New York? And when people start to say that, then it becomes almost inevitable.
The only thing that we did wrong was stay in the wilderness way too long. The only thing that we did right is get here, stand up and fight. Healthcare is a human right. We will stand up and fight. Healthcare is a human right. We will stand up and fight. Healthcare is a human right. We will stand up and fight. Healthcare is a human right.
Welcome back to Green Time. I'm host Don Fitz. With me I have Mimi Signor, our registered nurse, and Dr. Pamella Gronemeyer, who are respectively President and Vice President of Missourians for Single Payer. Now, we've talked about general issues of single payer versus saying Medicare for all, and we've talked about 3 states. What about Missouri? Is there a chance? What will we have to do in Missouri?
Well, I think Missouri's waiting for another state to go first, but Missouri's had a state single-payer bill since it was first introduced in 1990.
Okay.
And it's very similar to the Canadian Medicare program, and it has a progressive income tax. I think that we are waiting for another state to go first, and then we'll be more mobilized and energized to do this. But, you know, basically it's get co-sponsors and then have hearings.
It's been thought out. There is a bill, and it could it is a possibility. Dr. Gronemeyer, okay, could Illinois be that first state that Missouri would then follow?
Well, I don't think Illinois could be the first state, because I think a state like California, which is a large economy and really for it, could do it, and plus their economy is not bad. Now, in the state of Illinois, we've had, you know, as we know, we haven't had a budget, but now we have a budget, and I think that there is the progressive movement idea in Illinois, and we are hopefully going to have a progressive caucus in our state legislature. So, and we do have a bill that was written by one of the state reps, Mary Flowers in Chicago, and it is a bill, but it's never come out of committee. But I think in Illinois, if we could see that it would work, we could try it.
Okay. So both Missouri and Illinois are possibilities. Both have a long haul. I want to thank Dr. Pamella Gronemeyer. I want to thank Mimi Signor.
Thank you.
I want to thank our viewers for tuning us in. Be sure to look at Green Time, same time next week.